According to the CDC, there's been a daily average of 2.7 million vaccinations over the past week. And we're also seeing that in most states, about half of U.S. adults are vaccinated. But overseas, we're seeing a different situation, especially in India, hitting new record COVID cases. Also in South America, we're seeing a variant of COVID tearing through the area, especially Brazil. I want to bring in Suzanne Judd, epidemiologist at the University of Alabama at Birmingham School of Public Health, to talk about this. Suzanne, how worried are you about the situation overseas and the impact that could have here in the U.S.?
Definitely very worried. We're seeing here in the U.S. that young people are not flocking to get the vaccine the way that older folks did. So back in January and February, we didn't have enough supply because the people that were over the age of 55 and 65 really wanted the vaccine. We're not seeing many people between the ages of 16 and 35 interested in getting the vaccine. That's incredibly problematic if one of the variants comes to the United States. We could still be in the same situation where that variant would rage through those younger populations, and we could be in the same boat that we were in last year.
The fact that we've made so many strides, though, in this country with vaccinations, I believe close to 40% of U.S. adults have received at least one dose of the vaccine. Are we getting close to herd immunity, do you think?
We're on our way. We definitely are. We're probably halfway there, but halfway is not 100% of the way. And again, the fact that it's different by age, and we know that people tend to socialize by age. It's not uncommon that people in their 20s kind of hang out with other people in their 20s. And if that population's only 10% vaccinated, we could see the virus really ramp through that group.
And Susan, what are your thoughts on the new CDC guidance for wearing masks outdoors? I agree, fully vaccinated Americans in a small group, you can walk around without a mask. But how are we supposed to know who is vaccinated and who is not?
That's the complicated part of the new recommendations. It's you almost have to be really good at math to figure out, okay, this many people in this setting, I'm inside, I'm outside. So it is really confusing. I think to default, it's better just to go with the mask. Certainly outside, the one great piece of information that came from CDC is there have been very few cases linked to outside transmission, even when people are unvaccinated. So I think that should give folks a general level of comfort when they're outside and they see people that are unmasked. But inside, the mask needs to come right back on again.
What about in situations where, and I think this is affecting a whole bunch of Americans, where you have a family vaccinated getting together with another family who's been vaccinated, except for the kids who we know cannot be vaccinated yet? What do you do in that situation if you're all going to be indoors together? Do you still mask up because you have the younger set not yet fully protected?
Yes, in that case, you still mask up because this is the population that the variants are going to run through if they make it back into the U.S. The folks that haven't had the chance to be vaccinated, they're hanging around other people that haven't had the chance to be vaccinated. So in that situation, the best course is definitely to keep the mask on.
And Susan, you just mentioned there, if the variants make it back into the U.S., we definitely want to avoid that. So what is the U.S.'s responsibility in terms of helping Brazil, helping India, getting those vaccines out? I mean, what's the protocol right now to help the situation?
That's a good question. There are a lot of public health experts debating exactly what you're talking about. Should we redirect our own vaccine supply to other countries to help them get their outbreak under control, so that if they get theirs under control, it's less likely that we'll get virus variants that come in from these countries? I don't think there's a clear answer yet as to whether we redirect our supply or we try to get the younger folks in our country vaccinated. But that's definitely active debate right now in public health.
Do you think that these new guidelines from the CDC, I know that they tend to be a very conservative group, but are we really ready to start doing this? I think there's a lot of hesitancy on the part of folks. We've been, adhering to protocols for the past year now. This has been a very scary time for all of us. Are we perhaps lifting these restrictions all at once a little too soon when you do have other areas of the world where, like India, where things are so precarious right now?
That's another great question. I think it's good to lift the requirements right now. I think it's good to show good faith to Americans that when the science guides us that we're okay, places like Alabama, where our cases are less than 8 per 100,000 each day, that's probably safe to start getting together and loosening our behavior a little bit. Now, that said, we also have to rely on Americans to be reasonable. And if our cases spike, we need to go right back to where we were before. And that's something that's really challenging in our country is the back and forth and back and forth. But I think if people want freedom for short periods of time, that freedom may come at the price that we have to do some restrictions later on, but they'll never be as extensive as the year before where it was a full year of restrictions. Hopefully it's just 2 or 3 weeks.
Well, we're all about freedom. We just want to do it safely. Suzanne, Judd,
yes.
Thanks so much.